Hi class, let's start our discussion on the skeletal system. Our skeletal system can be broken up into two big recordings, so we're going to do two recordings each, about probably 25-ish minutes long for this body system. And if we look at the system, we're going to break up the recordings into one that focuses on the structures, the anatomy of the skeletal system. That'll be this recording, part one. And then part two is going to focus primarily on the joints and our articulations of our skeletal system and the bone physiology, or how our skeletal system can help us maintain homeostasis. So without further ado, let's dive into the skeletal system. What are the functions of our skeletal system? Well, first of all, it's going to support our body. How does it support our body? Well, we stand with our bones. Our bones are what the framework, so to speak, that our body is built around. And our skeletal system will also protect soft body parts, particularly if we look at the cranial cavity, or our skull. Our skull is wrapped around the brain. That's the classic example of our skeletal system protecting soft body parts. But we also have our rib cage protecting our lungs and our heart, and we'll have our pelvic girdle made up of the two coxal bones and the sacral and coccyx bone. And that's going to protect many of the organs of our reproductive tract. Our skeletal system is going to be responsible for blood cell production, particularly the red bone marrow inside of the spongy bone of our skeletal system will produce all of our blood cells. Our red blood cells, our white blood cells, and our platelets, or to use the technical terms, our erythrocytes, our leukocytes, and thrombocytes, respectively. Our skeletal system will aid us with mineral storage, particularly calcium and phosphorus minerals. And phosphorus is going to be stored as a polyatomic ion known as a phosphate ion. And the calcium and phosphate are going to be stored in a mineral known as calcium hydroxyapatite, which makes up most of the inorganic portions of our skeletal system, or most of the non-living or portions of our skeletal system. We'll also store a lot of fat in our skeletal system, particularly as adults in the hollow medullary cavities of our long bones. We store yellow bone marrow, aka body fat. And then finally, our skeletal system is the attachment point of our skeletal muscles. And this allows us to have voluntary movements. Maybe something like sitting down, standing up, or any other voluntary movement you may want to go to. I can't think of any worthwhile examples right now, but you know what it is to choose to move your body. So I'm going to move on to the next slide. If we look at a typical long bone, a long bone is going to be any bone in our body that's defined or that measures over twice as long as it is wide. So when we think of like the bones of the main bones of the arms and the main bones of the legs, those are the classic long bones. There's the middle section of the long bone, and I'm just going to skip these definitions and talk about the picture as I go over them, because it's easier if I talk about them while we look at the picture. There's this main section of the long bone known as the diaphysis. You can think of the diaphysis as the middle of the long bone. And then there's the ends, the proximal and distal ends of the long bone. Those are known as the epiphyses. And in case you're wondering, this is a humerus on the screen. Within the diaphysis, there's going to be a hollow cavity. This hollow cavity within the diaphysis is known as the medullary cavity. In young children and children that are not done growing yet, or adolescents that are not done growing yet, the medullary cavity is going to contain a lot of red bone marrow to aid with red blood cell or blood production. But in adults that are done growing, the medullary cavity will contain a lot of yellow bone marrow, because we don't necessarily need to generate as much blood per volume as young children do who are actively increasing their body mass. If we look at the epiphyses of our long bone, so the ends of the long bone, we're going to have the spongy bone structure. This is known as spongy bone, sometimes also referred to as cancellarious bone if you're working with somebody who's crusty and old school like I am. And this cancellarious bone is going to contain a lot of red bone marrow in both young children and in adults, although young children have a higher amount than the adults do. And this red bone marrow will aid us with blood cell production. The entire circumference or the entire outer border of a bone is going to be this solid looking tissue that's very hard. It's known as compact bone tissue. And then there's a membrane that wraps around the bone. It's called the periosteum. If we look at the periosteum, peri is a prefix that means around the surface of, or around the perimeter of, and then ost is a root word that refers to a bone. So a periosteum is the fibrous membrane that goes around the perimeter outside of our bones. And then finally, continuous with the periosteum, not shown on this figure, there would be connection points known as ligaments that anchor bone to bone. Ligaments connect bones to other bones, and we typically juxtapose ligaments to tendons. Tendons connect bones to muscles. Ligaments connect bones to bones. As we look at that compact bone is going to be very solid or compact in nature, and will have many repeating subunits known as an osteon. You can think of an osteon as kind of like, for lack of a better term, little trees. And if you slice through the osteon, it would look like a slice through a tree, as you can see all the individual tree rings. Let's go ahead here. Each one of these series of concentric circles, so we have 1, 2, 3 that I just pointed, are going to be 3 separate osteons. And each osteon, if you slice through it, will have these concentric circles in it that make up that osteon, or functional and structural unit of compact bone. Within the osteon that makes up the compact bone, we're going to have little hollow cavities known as lacunae, and those lacunae are going to contain the bone maintaining cells, the osteocytes, which maintain the bones. And then we also have spongy bone. Spongy bone, or as what was formerly taught as cancellenius bone, is going to have many little trabeculae, or little plates, that are going to have hollow spaces between them that are filled with red bone marrow. Also on this figure we have hyaline cartilage. Hyaline cartilage is going to be on the proximal and distal ends of our long bones at all of our articulation points. Sometimes it's referred to as articular cartilage, and this is going to help to reduce the amount of friction within our bones. If we look back at the osteon of the compact bone, you can see those dark spots that I'm pointing the point of my mouse to. Each of those dark spots represents the hollow space, the lacunae, that contains the osteocyte. There are 3 kinds of cartilage associated with our skeletal system. A cartilage is any kind of a flexible connective tissue that has a lot of extracellular matrix, and as opposed to the intracellular matrix, and it can be solid but still kind of flexible at room temperature. As we look at cartilages, we can differentiate them based on the kind of fibers they have within their extracellular matrix. The 3 kinds of cartilage are hyaline cartilage, which is the most common, fibrocartilage, which is the second most common, and then finally elastic cartilage, which is the rarest. Hyaline cartilage is going to be present at the tip of our nose, at the ends of the long bone, at the articulation points, at the ends of our ribs, in our larynx, and also in our trachea itself. You can think of hyaline cartilage as the slippery cartilage. The purpose of hyaline cartilage in our bodies sometimes is structural and sometimes is to reduce friction. Fibrocartilage can be thought of as a shock absorber. The fibrocartilage will form our intervertebral discs, or the disc between our vertebrae, and will also be present in the knee. Your lateral and medial menisci, or the menisci of your knee, are fibrocartilage shock absorbers that are much stronger than the hyaline cartilage present in the knee and aid to reduce compression in the knee. And then finally we have elastic cartilage. Elastic cartilage, as its name implies, is the flexible, stretchy cartilage. Our elastic cartilage will form structures in our body that can have lots of give and lots of movement, but always spring back to their original shape. These structures include our outer ears, or ear flaps, or auricles, and also include the epiglottis that folds down over the larynx to keep food from going down our windpipe or trachea. So, class, concept check. What 2 kinds of cartilage are found in the knee? This is a more difficult concept check question than most of the ones I typically answer. You're going to typically need to rewind the video and listen to it in detail, or you're going to need to check your textbook and look at the different structures of the knee. So go ahead and pause it right now and get me an answer. 5, 4, 3, 2, 1. The correct answer is fibro and hyaline. Yeah, C. C is the correct answer. It took me a second there. We have both fibrocartilage and hyaline cartilage in our knee. I'd mentioned that we have the fibrocartilage pads, the menisci, present in our knees, and then at the ends of the long bone, so at the end of the femur and the end of the tibia, we have a little bit of hyaline cartilage present in the knee that helps to reduce friction. So we have 2 kinds of cartilage in our knee. Hyaline cartilage to reduce friction, fibrocartilage to be a shock absorber. Let's move on. In our axial skeleton, or let's talk about skeleton as a whole. In adults, there are 206 bones in the skeleton. There are more bones in an infant and young child skeleton compared to an adult skeleton because in those young children, the bones have not fused yet. But in an adult, there are 206 bones. The skeleton can be broken up into two regions, appendicular and axial skeletons. The axial skeleton is going to focus on the skull, the rib cage, and the sacrum coccyx. So the parts of our skeleton diagram that have been highlighted blue here are the axial skeleton, and the parts that were not highlighted blue are the appendicular, or skeleton associated with the appendage. Let's first talk about the skull. The skull of our axial skeleton is going to be made up of both cranium and facial bones. Facial bones, as their name implies, are the bones of the face, and the cranial bones are the bones that enclose our brain. There's a special bone in our axial skeleton directly inferior, directly beneath the skull, known as the hyoid bone. And we also have the vertebral column, all of our vertebrae, and the intervertebral disc, and the rib cage, which is going to be our rib and sternum. So this is all part of our axial skeleton. So let's talk about the cranium. Our cranium's job is to protect the brain, and there are 8 bones of the cranium. Some of these bones are going to have some hollow cavities in them known as a sinus. When somebody has a sinus infection, that hollow cavity can no longer drain fluids or have airflow through them and actually have a vacuum pressure buildup in them that causes that intense sinus headache. The bones of the cranium include the frontal bones, the parietal bones, the occipital bones, and the temporal bones. We have 2 parietals, 2 temporals, an occipital, and a frontal. We're also going to have, much more difficult to see here, we have a sphenoid bone, and then we're also going to have, much more difficult to see, not shown here at all. We have the sphenoid, and then we also embedded deep down in there the ethmoid bone as well, that make up the cranium. Now we also have bones of the face. These bones of the face are the bones associated with facial structures, and there's a little bit of overlap between these guys. For example, the frontal bone typically is going to be categorized as a cranial bone, but the frontal bone also forms the top of our orbit or eye cavity, and definitely will be categorized as part of the face as well. Other facial bones include the nasal bones, we have the lacrimal bone, we'll have the maxillary, or maxilla bone, we'll have the mandible or lower jaw, we'll also have the vomer and the palatines and the cheekbones as well. The cheekbone being known as the zygomatic bone. Connecting the bones of the cranium, we have sutures. A suture is an inflexible joint, and these are not in your textbook, but I added them specifically to this PowerPoint because you need to know the sutures of the skull. These are medically very important. When a child is being born, the sutures of the skull are not fused, and instead these sutures will flex to allow the child to move through the birth canal. As the child is moving through the birth canal and these sutures are flexing, many times the child will be born with a cone head or egg head appearance that will very quickly go away as they age. We have one suture that's going to be on the frontal plane or coronal plane. I'm wiggling my mouse over it right here and also right here. That is the coronal or frontal suture. There's another suture that will connect, that squiggles back and forth on the lateral margins of the head. That is known as the squamous suture. There's a suture that goes right down the mid-sagittal plane of the skull that connects the two parietal bones. That is the sagittal suture, highlighted pink right here. And then, if we follow that sagittal suture towards the posterior back of the head, it will divide and go to the left and right. As it goes to the left and right, that forms the lambdoidal suture, or lambdoid suture. We call it the lambdoid suture because it looks like the Greek letter lambda as we combine it with the sagittal suture. So if I follow down on the sagittal suture and go to the left and right with the lambdoid suture, it looks kind of like the Greek letter lambda, hence the name lambdoid suture. Bones that are exclusive to the face include the mandible, maxillae, zygomatic bones, and nasal bones. The only bone in the body, the hyoid, that does not articulate with any other bones is found directly beneath the mandible and kind of floats in our throat area, on the front of our throat, beneath our jaw. Something that's unique about the hyoid bone is that it serves as an anchoring point for the tongue and other muscles of the larynx. And from a medical standpoint, it's very difficult to fracture or damage the hyoid bone. Not many people get hit in the throat. Generally speaking, the only time someone's going to have enough damage to their throat to fracture the hyoid bone is if something bad is happening. For example, you're in a car accident, you get clotheslined, or if somebody has potentially strangled you or tried to strangle you. So here's our bones of the face, and then here's that hyoid bone, directly superior to the larynx, and then directly inferior beneath the mandible. I like to refer to the hyoid bone as the vampire bone because it has these two extensions that extend superiorly from it that look like the fangs of a vampire jaw. In our axial skeleton, we also have the vertebral column. There are 33 total vertebrae. Of those vertebrae, we have cervical, thoracic, lumbar, sacral, and coxal vertebrae. Here's a picture of a cervical vertebrae. Our cervical vertebrae are differentiated from other vertebrae in that these are the only vertebrae that have transverse foramen, or holes on the left and right. Then we have a lumbar vertebrae, which is slightly larger than the cervical vertebrae, and will have articular facets for the ribs on them. The lumbar vertebrae, generally speaking, are referred to as the largest vertebrae and are characterized by having a very large vertebral body. The sacrum and the coccyx typically will be fused with each other, sacral vertebrae being fused to form the back of your butt, so to speak, or your posterior, and then the coxal vertebrae forming what is known as the tailbone. To help remember the numbers of vertebrae involved, because sometimes it's just tough to memorize 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, 4 coxal. If you can remember when you eat meals, 7 a.m. breakfast, 12 noon lunch, and 5 p.m. dinner, it'll make it a lot easier to remember that there's 7 cervical, 12 thoracic, and 5 lumbar vertebrae. And in between the cervical, thoracic, and lumbar vertebrae, we have shock absorbers. We have intervertebral discs that are made of fibrocartilage that help to absorb pressure on our spine. Here's a picture of the natural curve of the vertebral column. We number our vertebrae from the top down, or from the superior to inferior direction. And we restart the numbering sequence every time we switch vertebrae type. So we have C1, which is the top cervical vertebrae, then C2, C3, C4, C5, so on and so forth, down the cervical spine. And then we get to the lumbar spine and go L1, L2, L3, L4, so on and so forth till we get, T1, T2, T3, T4, as we have the thoracic spine. Oh, what am I thinking? I can't believe I called that lumbar. This middle portion is the thoracic spine, L1, L2, T1, T2, T3. Then we get to the bottom portion, the lumbar region, where we have L1, L2, L3, L4. And then at the base, we have the sacrum and then the coccyx. Branching off of our 12 thoracic vertebrae, we will have ribs. We have 12 pairs of ribs that correspond to the 12 thoracic vertebrae. Our rib cage, or thoracic cavity, is going to protect the heart and lungs. And our ribs are very flattened bones that originate from all of those 12 pairs of thoracic vertebrae, or 12 thoracic vertebrae. Each thoracic vertebrae has 2 ribs, so we have 12 pairs total. Of our ribs, we have 7 true ribs and 5 false ribs. And of those false ribs, generally speaking, 2 of them are going to be categorized as floating ribs. And then in the center of our center or mid-sagittal plane of the anterior of our thoracic cavity, we have the sternum or breastbone that the 7 true ribs attach to directly. So if the rib attaches to the sternum directly, it's going to be a true rib, and if they do not attach to the sternum directly, they are a false rib. So, over here, there's 3 pairs of false ribs. This is a typo. This should be 5 pairs of false ribs. Let's look at this figure over here. Here we can see the rib cage. We have our 7 true ribs that all directly, with some hyaline cartilage intermediates, go to the sternum. False ribs have hyaline cartilage that connect to more hyaline cartilage. And our last 2 false ribs don't have any hyaline cartilage on them at all. Those are known as the floating ribs. So, class, concept check. While an infant is being born and traveling through the birth canal, what primarily allows for the infant's skull to flex? Is it elastic cartilage, sutures, articular cartilage, or pivot joints? Go ahead and rewind the video and get me an answer. It is not in your textbook, so don't bother checking there. 5, 4, 3, 2, 1. The correct answer is B. Sutures allow for the skull of an infant to flex while it is moving through the birth canal. Let's move on to the appendicular skeleton. Our appendicular skeleton is essentially the skeleton, part of the skeleton that's associated with the arms and the legs. That will include the pectoral girdle and the upper arm, and the pelvic girdle and the legs or lower limb. And I said upper arm here, I meant upper limb, not upper arm. So what's our pectoral girdle? Our pectoral girdle is going to be made of the clavicle and the scapula. And the clavicle or collarbone and the scapula serve as the anchoring point for the arm. So the pectoral girdle is how the arm is anchored to our main torso. And then we'll have the upper limb, aka the arm and hands. And within that upper limb we'll have the humerus, then we'll have the radius and the ulna, the carpals, metacarpals, and the phalanges. Then we'll also have in our appendicular skeleton, the pelvic girdle. Half of the pelvic girdle is referred to as a coxal bone. And that coxal bone is made up of ilium, a pubic, and an ischial bone that are all fused together. As we were being born, the pelvic girdle, and these coxal bones can flex quite a bit to make it easier for the hips of the infant to make it through the birthing canal. The lower limb or leg and foot includes the femur, the patella, the tibia, the ulna, the tarsals, metatarsals, and phalanges. If you look at the skeletal remains of an individual that's passed on, you can make inferences based on that individual as you look at the skeletal remains. Some things that you can determine from the skeletal remains include age, through the dentition, or how the bone has been ossified, or how the bone has formed, and the condition of the joints present in the bone. You can also, not mentioned in the slide, determine to some degree the diet or locale where that individual spent a large portion of their lifetime based off of isotope analysis of the bones. You can also determine gender based on the bones. Typically, you'll want to use the pelvic girdle or pelvic bones, but you can also look at the thickness of the long bones or some characteristics of the skull for gender determination. And then finally, if you have an intact skull, you can tell the ethnicity. Here's a pelvic girdle of a male. Notice how it has a narrow opening with a high pubic arch. In a female, the opening is much larger with a broader pubic arch. It's easier for a baby to pass through the pelvic girdle of a female compared to a male. I'll be done recording in just a moment. If you look at skulls, you can have broad ethnic determinations based on skulls. Our ethnic areas are going to be European, Asian, or African descent. We could have Caucasoid, is the official term, Mongoloid, or Negroid. Caucasoid, or people of European descent, typically are going to have a flat forehead and a flat mandible with a protruding nasal or nose. People of Asian or Mongoloid descent will have a flat forehead, nasal bone, and mandible. And then yeah, that was my son. And then individuals of Negroid descent typically are going to have the flat forehead, a slightly protruding nasal bone, and then a largely protruding maxillae and mandible. So, class concept check. What can be determined with relative confidence if you have a complete skull? Age, gender, weight, ethnicity, or your IQ intelligence quotient. Go ahead and get me an answer right now. 5, 4, 3, 2, 1. The correct answer is ethnicity. You can have an approximate determination of ethnicity if you have somebody's skull. And that's all we have for this recording. If you have any questions, please feel free to post them on the class discussion board, shoot me an email, or swing by my office on campus. Happy studies.